Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What is trench foot? Trench foot is an injury that occurs when feet are exposed to cold and wet conditions, but it is not due to freezing, as in frostbite. It is one of three types of immersion foot, with the other two types being warm water immersion foot and tropical immersion foot. /r/n/r/n As the feet continue to be cold and damp, the body constricts the blood flow to prevent heat loss. This results in a lack of oxygen supply to the feet and subsequently results in damage to tissue. As the skin begins to break down, open sores and blisters often result in bacterial or fungal infections. /r/n/r/n Trench foot and other immersion foot disorders differ according to the temperature of exposure to non-freezing, damp conditions, as well as unsanitary conditions at times. /r/n/r/n/Huntstock, Getty Imagesrnrn Symptoms of trench foot may include /r/n/r/n Symptoms of trench foot can involve the toes, heel, or the entire foot. In very severe conditions it can cause swelling of the leg all the way up to the knee. /r/n/r/n The symptoms usually appear after exposure to conditions for a day or two, but they can begin in as little as an hour after exposure. Some people can be exposed to a cold, damp environment for up to a week before symptoms appear. /r/n/r/n The severity of the symptoms of trench foot depends on the temperature, how wet the feet get, and the length of exposure to coldness and wetness. /r/n/r/n Trench foot is often categorized into one of four stages, including /r/n/r/n Stage 1 Injury Phase /r/n/r/n This stage involves restriction of the blood flow due to cold tissue. Symptoms may include numbness and reddened skin, but pain has not yet begun. /r/n/r/n Stage 2 Prehyperaemic Phase /r/n/r/n This stage lasts from 6 to 24 hours. Symptoms include pale, white-colored, cold feet with paraesthesia, pins and needles sensation. The ankles and toes are stiff, making it difficult to walk. /r/n/r/n Upon examination, a healthcare provider may not be able to palpate, feel, the normal pulses of the feet, indicating that normal blood flow has been impeded. /r/n/r/n Stage 3 Hyperaemic Phase /r/n/r/n This phase lasts up to 2 months. Symptoms include painful feet that are hot to the touch. There is swelling that worsens with heat, movement, and standing. /r/n/r/n In severe cases, small blisters may be seen. Bruising, along with petechiae, rash-like spots on the skin may be present. When trench foot is mild, the condition usually resolves with treatment at this stage. If it is severe, trench foot symptoms progress. /r/n/r/n Stage 4 PostHyperaemic Phase /r/n/r/n This phase may last for the duration of the person's life. This is a long-term vasospastic, narrowing of the blood vessels, phase involving increased pain on warming, hyperhidrosis, extreme and excessive sweating, of the feet, and paraesthesia, pins and needles sensation. /r/n/r/n The affected foot/feet may develop a sensation of being cold permanently. Secondary Raynauds syndrome, a condition involving an exaggerated sensitivity to cold in which the toes turn blue and/or white upon exposure to cold and then bright red on rewarming, develops as a result of long-term constriction of small blood vessels. /r/n/r/n Study A 2013 study reports that trench foot usually starts with tingling and itching, which progresses to numbness. Restricted blood flow can cause reddened skin and a bluish discoloration, called cyanosis. In the later stages, as the foot is rewarmed, hyperesthesia, excessive physical sensation, may occur. /r/n/r/n Odor, decay, and necrosis, death of tissue, may occur with prolonged exposure. The feet can swell in some instances significantly. In fact, there are some descriptions of the feet doubling in size due to edema, swelling, /r/n/r/n complications that may occur as a result of trench foot include /r/n/r/n. The primary cause of trench foot is long periods of wet, cold feet. But, unlike frostbite, this occurs without freezing temperatures. The condition usually results from exposure to temperatures of between 32°F to 59°F, but a temperature as warm as 60°F could cause trench foot when exposure occurs over a period of at least 10 to 14 hours. /r/n/r/n. When the feet get wet, they lose heat 25 times faster than dry feet. /r/n/r/n. When the feet are cold and moist, destruction to small blood vessels, called capillaries, can lead to the breakdown of surrounding tissue. Constriction, vasoconstriction, and dilation, vasodilation, of the blood vessels is thought to be the cause of local tissue damage. Excessive sweating of the feet can also be a contributing factor to trench foot. /r/n/r/n. During World War I, trench warfare was a common combat tactic in Europe. Soldiers found themselves standing in wet, muddy trenches for long periods of time. /r/n/r/n. In 1914 it was observed that trench foot mostly affected the toes, but it sometimes involved the legs, which would swell up as far as the knee area. When it worsened, there were blisters filled with clear fluid that smelled foul, like gangrene. /r/n/r/n. The result was that over 20,000 British troops were reportedly treated for trench foot. It is estimated that nearly 75,000 British soldiers and 2,000 American soldiers died from health conditions that involved complications from trench foot, or from conditions that were complicated by the disorder. /r/n/r/n. But, trench foot was first discovered further back in history. In fact, it was described by a French army surgeon named Dr. Dominique Jean Léry during Napoleon's fight with Russia in the Patriotic War of 1812. /r/n/r/n. Trench foot is not very common among the civilian population, but it can be seen in homeless people due to unsanitary conditions and the inability to keep feet warm and dry. The condition is also seen in fishermen because they are prone to having wet feet for long time spans, as well as hikers. /r/n/r/n. A thorough physical exam, combined with an assessment of the environment and situation in which symptoms occurred, is the basis for formulating a diagnosis of trench foot. /r/n/r/n. In addition, other possible causes, such as an infection, must be ruled out. Therefore a white blood cell count, WBC, may be ordered. A bone scan or other imaging tests may be ordered to rule out any type of osteomyelitis, infection in the bone. /r/n/r/n. Many treatment and prevention measures for trench foot are the same. These include /r/n/r/n. For neuropathic pain, nerve pain, your healthcare provider may prescribe amitriptyline or other medications. /r/n/r/n. If gangrene occurs, amputation of the extremity may be required to prevent further progression of the disease, and to keep serious consequences, such as sepsis or death, from occurring. /r/n/r/n. The best treatment for trench foot is prevention. Preventative measures include /r/n/r/n. During World War I, soldiers were ordered to inspect their feet daily. They were also paired up and instructed to observe the feet of their partner, because it was discovered that a soldier was more likely to remove the socks and boots and dry the feet when a fellow soldier was there, to ensure that meticulous foot care was conducted. /r/n/r/n. After trench foot occurred in thousands of soldiers, the soldiers were all ordered to carry 3 pairs of socks with them at all times. They were ordered to change and rotate the dry socks at least 2 times each day. They were also instructed to massage the feet after they were dry with whale oil. /r/n/r/n. The trenches were kept as dry as possible using wooden boards to keep soldiers from walking in the water. These boards were called duck boards. Exposure to the outdoor elements was limited by the employment of troop rotation. These measures were found to decrease the incidence of trench foot. /r/n/r/n Complete recovery is expected when trench foot is diagnosed early, but when sensation returns, there can be severe temporary pain to the affected area, even when a complete recovery is expected. /r/n/r/n Although the symptoms of trench foot may be alleviated by slowly warming up the affected extremity, there is a possibility of long-term, chronic, tissue damage and chronic pain, particularly in severe cases. /r/n/r/n A person who has been diagnosed with trench foot could end up requiring long-term follow-up medical intervention for one of several potential complications of trench foot, such as long-term damage to the blood vessels. /r/n/r/n The amount of exposure time, coupled with the severity of the influential factors, such as outdoor temperature, will factor into a person's prognosis. /r/n/r/n First, clean and air dry your feet. Keep your feet clean and dry until the symptoms clear up. Elevating your feet and keeping them uncovered at bedtime can help with healing. If there are signs of an infection, though, see a doctor right away for other treatments. /r/n/r/n Yes. In some cases, you can develop trench foot if you have excessively sweaty feet, known as hyperhidrosis. The risk is increased if your feet are subjected to cold temperatures for an extended period of time or if you have injuries. /r/n/r/n Unfortunately, yes. Trench foot, or immersion foot, can affect anyone whose feet are wet for a long time. Those who engage in outdoor activities such as camping, hiking, fishing, and other recreational sports, particularly when being outdoors in the rain for extended periods of time, should be aware of the risks of trench foot, as well as how to prevent it. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.